Hello, welcome to another episode of Daily Wisdom Words podcast. I am your co-host, Rini O'Day.
Hey everyone, I'm Neil Trivedi, and I am also your co-host. We want to thank you for joining us today and give you a very warm welcome to another episode of the Daily Wisdom Words podcast.
Daily Wisdom Words is an online community for writers and poets all over the world. Join us every Saturday at 9 a.m. Pacific Standard Time, where we will talk to some very distinguished guests, each one specializing in topics you don't want to miss. Today, we are in conversation with addiction specialist and dissociated identity disorder expert, Dr. Andreas Eldridge. Good morning, Dr. Eldridge.
Hey,
Good morning.
Dr. Edrich.
Thanks for having me on.
It's so great to have you. Yeah, it's our pleasure. We are so excited to have you on our show. It's a real treat for us.
Yeah. And I will learn how to pronounce my words so that we can maybe get through this.
It's all good.
Yeah.
Okay. Well, you are an addiction specialist out of Edrich, Colorado. And, we are all familiar with addiction. But can you explain what exactly addiction is in terms of, what goes on someone's mind and when they get addicted to it, what is happening in there?
Yeah. There's so much chemical and deep down electrical phenomenon that happen in the brain that they've gotten better and better over the years explaining exactly what part of the brain's talking to what part of the brain that's driving it. But from a global standpoint, from what, clinically addiction means and how it matters to patients and loved ones, of course, is using something, using something for a purpose for which it's not intended, in doses that it's not intended, from sources where it's not intended, and using that to help mitigate feelings, and then not being able to get free from that tool, that substance, without significant withdrawals, and spending time, money, and effort doing it when in fact you should be spending that time, money, and effort doing other things,
Mm-hmm.
And that's a real crude way of describing addiction, when we essentially use maladaptive coping skills to take care of usually emotional problems, right? So
Absolutely.
Whether it's oxycodone pills or marijuana or alcohol or Oreo cookies or gambling, or it doesn't matter what it is.
Did you just call my Oreo cookies addiction?
I called our Oreo cookie addiction
okay, good.
a maladaptive pattern. Exactly.
Mm-hmm. Mm-hmm.
And again, you have to guide me in terms of what questions you have, but oftentimes
we have a ton.
You have a ton?
Mm-hmm.
I'll try to explain it more from a patient's standpoint, because that makes more sense to a lot of people go ahead.
Absolutely. Well, I just want to, sorry, Neil, I'm kind of stepping on Neil here a minute.
No.
I just want to know the
ahead.
difference of a chronic pain patient under the supervision of a doctor and the guy that goes out on the street and gets is there a huge, difference in the mind?
A massive difference, absolutely, and one can lead to another. And this is a good segue into a lot of my patients and how they start. So let me give you an example of how these people start. Sometimes people have an injury, an ankle injury, a toothache, something.
Mm-hmm.
And they get some Vicodin, some oxycodone for the pain management. And then, even though the ankle heals up, they realize that, oddly enough, the oxycodone helps kind of calm down their brain a little bit, which is convenient, and what's the harm? It's a prescribed oxycodone. It's not like it was anybody else's on the street. And what if you use one pill a week when you're giving a presentation to your group of 200 and it calms you down a little bit? And it hardly ever happens more than once a week, maybe twice a week. But hardly ever more than 3 times a week. Really, the one time
Oh,
was an
yeah.
exception when my in-laws came in, and then everybody understands I had to use it on that weekend. But it's never more than 9 times a week, and it's hardly more than 2 or 3 pills. Okay, my friend had some leftover ones. He wasn't using them anyways, so I got those too. And it starts to cascade, and you realize soon enough that they're using these medications as mental, substances to help
Yeah.
their coping strategies.
Yeah.
And then they get stuck, and then they come to me going, how the heck did I get here? It was so insidious. It was slow. Now, when you talk about chronic pain patients, most of our chronic pain patients, they'll start as, acute pain, obviously, but sometimes they come in with, 500 screws and bolts and plates, and they've had 50 surgeries and all sorts of stuff. They have chronic pain management problems. They're a different animal, though. They are a different animal. Those patients almost never really, they have it's easier to kind of keep them in that chronic pain range where we're using the medications appropriately. But again, to prevent those medications from running out of control and being used for depression and anxiety, you have to monitor that stuff carefully, because there's a big difference between, there are some folks on the street, they never had any pain issues. They just started with Oxy on the street because, they started at age 12 or 13. And where do
that just gives me chills.
Right?
Yeah, it gives me chills.
12 or 13, I take care of, I run 6 methadone clinics.
Wow.
I take care of it. We've got 1,000 heroin addicts, and they're, a lot of them have recovered. They were doing well, but I ask every one of them, they might be in their 20s or 30s or 40s. And I ask them, hey, how old were you when you started anything? Like 100 years ago, what did you start with and why? And their answer is always the same. The most common words out of their mouths are, and this is over hundreds and hundreds and hundreds of addicts, oh, I started at age 12 or 13 with weed. And it's always the same. 12, 13, 12, 12, 13, 14, 12, 13, 14, which is middle school, right? And that's where stress and self-esteem sucks. That's where your parents are annoying and not, But Johnny,
it's
right?
true.
Yeah.
It's
Johnny
true.
Johnny at locker number 27, Johnny, your best friend in middle school, he has an answer, and he has weed,
And I blame in a sense, well, blame is not the correct adjective, but the schools, they're too stressful. I had 3 children go through, school, and it was like crazy. So how do we calm that? How do we make it so kids aren't so stressed that they have to depend on Johnny to get them something?
I think number one, it starts with recognizing, like you have, that we need to allow children to not be overtaxed. Things have changed a lot since the 70s and 80s. We all know that. And things have gotten more complicated. There are more pressures on children, and it's multiple different pressures. It's not just school. Look at social media.
Sports.
Look at what Facebook, sports, right? Look at what Facebook just admitted to, knowing that their platform creates these emotional distress problems in children. And in an age when kids are the most vulnerable, again, why do all my heroin addicts say most addicts, why do they say they start at age 12, 13? Because it's middle school where they're feeling bad. And now we have social media platforms that are reinforcing those sensations, parents that are too busy working, that don't have time to kind of sit and honor their kids' stress, pressures with academics, pressures with sports, right? Lack of nurturing from home. It all comes down to, if we don't feed our kids the primordial feelings that they need, they're going to find it elsewhere. Like, that's just how it is. And if we don't provide it, they'll find it. I asked a 16-year-old heroin addict. He had a horrible childhood. I said, what does heroin do for you? What did you like about it initially when it worked? Of course, now it's just withdrawals. It's horrible. But when it did work, what did you like? And this 16-year-old kid said to me, he said, when I use heroin, I feel like I'm being held in my mother's arms.
Oh,
wow.
Now that's not, you can't tell a 16-year-old, oh, you don't deserve that feeling, of nurturing. No.
Yeah.
The fact that he found that feeling of nurturing in heroin, that's totally suboptimal. That's not good,
Yeah.
But I told him, I said,
yeah.
I don't blame you for that's all you had that's what you were given. That's what you found. Awesome that you found it. Not so awesome that it was this. I wish I could have. So it comes down to that primordial need that we as humans have, acknowledging our pains, acknowledging our stressors, acknowledging that a lot of the stress that these kids are going through is artificially created. It's created by essentially an evil social empire that desires to have their attention at any cost.
Everybody needs a puppy.
Everybody needs a puppy. Yep.
That's our mascot, by the way. Our podcast.
Yeah, this
mascot,
is Kona. Sorry, I did not mean to. I interrupt you because you were on the perfect. This was just giving me like the feels. When you said that this boy wanted to be held in his mother's arms, just.
Yeah, that was very deep. Yeah. What? Another thing is when we talk of addiction, and you brought up a very good point about starting very early on, right? That's at least many people, that's how they get started. Right. And one thing you hear even after many years is always the word recovering, right? Oh, I'm a recovering alcoholic, not recovered or not. So why is that? Does addiction ever truly go away, or do people just need to be cautious? Why do they use the phrase recovering instead of recovered?
That's a fantastic question, because addiction is amazingly, at the same time, not amazingly, so exactly identical to pretty much every other disease we have in the body, except we've totally ignored it. There is basically very few diseases that we cure. I mean, think about it. Diabetes, blood pressure, low thyroid, cholesterol. We don't cure anything. We control a lot of stuff. We manage a lot of it. We cure strep throats, bladder infections, and hangnails. And that's about it.
What about cancer?
Well, look at cancer. We manage it. We're not good at curing it, right? And cancer is a great analogy, because I oftentimes call addiction the emotional
cancer of the brain.
The cancer of the brain, because it goes into remission, but it rears its ugly little head if you don't control it.
I see. You call it remission then.
That's true.
Okay. Yeah. Okay. Right? In cancer, in the cancer world.
Right. They're in recovery. They're recovering. They're still working it, because they have a handful of things to do to maintain that remission, that recovery. If you look at the brain's wiring, and this comes down to neurochemistry, the brain becomes rewired when you introduce substances to it early in life, which is logical. It's kind of like a younger diabetic who's generally always on insulin permanently, and an older diabetic, sometimes they just need pills and diet control, but the younger you are, when you introduce chemicals into the brain, especially heroin, especially fentanyl, these harder opioids, it actually rewires the brain. And it rewires the brain so that predisposition to addiction never goes away. As soon as they stop doing their thing, as soon as they stop their controlling mechanism, it comes back. As soon as you stop your insulin, it rears the sugar goes up again. As soon as you stop your meetings, your therapy, your Suboxone, your methadone, that original problem starts to ramp. It's different than a 45-year-old that starts using opiates. There's a much better, their brains are fully developed. But what if we mess with the wiring diagram of an undeveloped brain. Kids' brains don't develop until they're 20 to 25. Remember, I told you, I ask all my heroin addicts when they started with substances. The answer is always 12, 13, 14, predominantly 12, 13. Once in a blue moon, they'll say 10. Once in a blue moon, they'll say 25. Almost all of them. And so it becomes a permanent disorder, and it's so difficult to convince patients, look, your job is the same as a diabetic. Recognize it, get it under control, use whatever tools you need, sometimes meds, sometimes therapy, sometimes this, sometimes that, I don't care, acupuncture, there's a lot of wonderful things that help, and set it and forget it. Get your thing under control, just like my friend who has diabetes. We have lunch, he does his insulin, then he looks at me and he says, did I do my insulin already? And I'm like, I don't know. You did. You do it so fast and subtle, I don't even notice it anymore,
Right. Yeah.
I want you to set it and forget it and move forward with your life. You don't focus on the method. Don't focus on Suboxone. Don't focus on your life, your relationships, your kids, your work, your career. Like, wait, allow this to exist. Honor the fact that it's permanent and it ain't going away ever. Honor the fact that we will use the least amount of medications to get the problem under control, just like a diabetic. I'm not going to use more insulin than I need. But once it's there, focus on more important stuff, because everybody and their dog will give you advice on what you should do. That is, everybody who doesn't have skin in the game is going to offer you and tell you what you need to do. Oh, you shouldn't do methadone. You shouldn't do Suboxone. That's just a replacement for your, they don't have skin in the game. They don't have to suffer withdrawals. They don't have to pay half of the felony. They don't have to pay half of the jail time. They don't get half of the decision. They're just empty talking, and they don't understand how this, it's like telling a patient, you don't need insulin. That's just a replacement for bad habits. You should just be able to do it with your diet alone. No, there are times you need medications and therapy and et cetera, so get it under control. So that's why addiction is a permanent disease most of the time, and treating the underlying, people always ask me, what's the difference between an addiction specialist and a psychiatrist? And I say, it's in the word. Have you ever met anybody with addiction who doesn't also have psychiatric problems? It doesn't exist. They always go together. People use this word dual diagnosis. But how is it not the exact same thing? Like, who doesn't have dual diagnosis? If you have addiction, by definition, you have mental health problem. Like, that's just a given, And so I always tell people, man, you don't have to have an addiction. I'll take care of you. I love it when I get teenagers who have depression, anxiety before they've reached to substances. That's awesome. It's easier. But does that sort of answer your question?
It was absolutely perfect.
Yeah. I don't think I've heard a more articulate, expressed answer than before this time.
Someone give me that medical dictionary.
Right. And yet everybody thinks that somehow, this is just going to go away. This is going to wash away. No, this is not going to wash away.
Well, do you think it's a combination of, it's obviously a disease and mental health.
Right.
So you're kind of bumping up against each other.
Right.
So you have to treat it as a disease. Right.
Hallelujah.
Now, as I was just researching, I came across an article about the soldiers in Vietnam using heroin.
Yeah.
And they came back without withdrawals.
That's right.
What's that all about?
That's an interesting study. And a lot of that has to do with, number one, they're not 13 or 15. Granted, they're in their early 20s. And the stressor, that massive stressor they were, and yes, some of them did come back with a lot of PTSD. And those people did not stop using something, whether it's heroin or other opiates.
Okay.
But the ones who, when you remove them from that horrifying scene, the situational reaction goes away. The need for the heroin goes down. They don't become long-term addicts. But what they didn't appreciate is there is this thing called addiction rotation, where oftentimes they come off of one substance, go on to another. So they'll go away from heroin, but then they'll find themselves in alcohol. And that wasn't looked at,
I see.
as another substance. But you're absolutely right. It's a multifactorial. It has to be treated from every angle, and every single patient is different. I don't have the same treatment protocol for 10 different patients because, for example, what if I do have a patient with chronic pain, And what if at the same time they also have depression, anxiety, and the opiates help kind of control the depression, anxiety, but at the same time they have a legitimate need for pain management? You got to balance both of those, So
Very
oftentimes we will pull them off of the traditional opioids, use tools like Suboxone that allows us to control sort of the cravings and the withdrawals, but also provides pain management. And then really importantly, focus on all the underlying problems. So for a lot of our patients, they'll ask me, well, how much of our work is going to be addiction versus psychiatric? It's going to be the same.
Has
to be the same. We're going to spend a pretty short period of time taking you off your heroin, off your oxy, and putting you onto something like Suboxone. And then we're going to spend an enormous amount of time talking about what are the underlying problems that started this whole ball going. Where's the depression? Where's the anxiety? Where's the family discord? Where is where's the trauma from the past? Those are the things that we're going to work on, because the whole rule. When people are discharged from rehab, what happens? They relapse 32 seconds later.
Yeah.
Right?
Mm-hmm.
Our addiction society president always says, rehabs are great for a lot of things, but staying off of drugs is not one of them. And the reason is that they don't honor the fact that it's great when you're in four walls, but when you're discharged and there's nothing there and no tools and no protection for the actual wiring, then they relapse. If you have a diabetic in a facility and everybody's cooking perfectly and your exercise, you have trainers all over the place and your calories being counted everywhere, that's great. But what happens when you discharge them to the real world again? Then who does that,
Well, I have Neil standing outside with a Milky Way bar.
Right?
Seriously.
And once you've had a Milky Way bar, nothing else
you can never go back. Sorry.
Right?
Sorry.
Yeah.
It's like, I don't mean to make light of this, because you really are.
No.
You're just amazing. I'm learning a lot.
But it's such such a great field, because here's the reason why. Every other medical field has been like its own little science, and everybody nerds out on it, and they come up with all these tools and ideas and understandings of how cholesterol, blood pressure, all these things work. And we have such a great understanding, but we've all blown off our brain. We've all ignored the hard drive, Like if we actually spent as much work on our brain as we do if we honored our brain half as much as we do every other part of your body. If you mess up your back from lifting rocks, I'm going to say, hey, here's some muscle relaxers and here's physical therapy. And you would say, well, yeah, of course I'll go do that, because I need to have goals. I need to get back on my feet, do this, that, and the other. And that would be logical. Why would I even give you medications? I give you muscle relaxers, not to go home and sit and watch TV. I give you muscle relaxers so that physical therapy becomes more effective. They can't work with you if you're muscle spasming, writhing on the floor, And at the same time, they're going to call me for muscle relaxers if they can't make progress. So those two go together, but we do it for every part of our brain, every part of our body, except for the brain. We've totally brain, it doesn't deserve that care. And we hear that from the older generations. Oh, I don't want to be weak. My brain doesn't need that. It can go ahead and suffer and rot away.
Oh, boy.
Ironic, right? And here's the thing. Anytime you have only one of an organ, like we have 2 eyes, 2 ears, 2 kidneys, arms, legs, fingers, we have a lot of duplicates, but all the things that you only get one of, you ought to probably pay a little more attention to those, your brain, your liver, your heart,
good point.
And yet the brain is the last one we ever address, because somehow it doesn't deserve care because of our society's messed up views on what needs treatment and what doesn't. And it's sad because the science of this is so unequivocal. We have pinned the exact DNA location for example, alcoholism. We know exactly where it is. In fact, that test is going to become commercially available. You can check your newborn for alcoholism gene probably in the next few years. We found the
Wow.
gene. We found the gene that causes breast cancer, right? Like you
Long
can
time
check a
ago.
young
Yeah.
girl and say, "Ooh,
Yeah.
she's high risk." Doesn't mean
Mhm.
she's going to get it. Just means she's at high risk. We've
Mhm.
always known these things are genetic. Grandpa has
Mhm.
alcoholism, dad has it, kid has it, grandkid. I mean, it's kind of obvious, right? Now
Yeah.
we can
Mhm.
look under the hood and we know exactly which spark plug is messed up that's causing it, And
Mhm.
that's cool because it proves, but it took this long. I joined the American Society of Addiction Medicine. See, I trained as a family doc 20 years ago, and then I got dual board certified in addiction medicine. And I joined the American Society of Addiction Medicine years ago, and it was its own society for about 50 years, and it was finally recognized by the overseeing board that addiction medicine should be classified as its own specialty finally.
Mhm.
Do you know when that occurred?
Mm-mm.
That happened
When?
3 years ago. How sad
Wow.
is it that it's taken
What?
this
That's
long
crazy.
for the medical boards to even recognize addiction medicine as a true specialty? So now we
Mhm.
finally
Right.
have the American Board of Addiction Medicine, which was just
Mhm.
formed. And I called them
Yeah.
because I did my board exams for the American Society of Addiction Medicine, and it's like every board, it's long, but there's no fellowship in it. It's a self-taught kind of you have to just treat patients with addictions and document what you're doing, and then you get boarded in it. Now
Mhm.
with the official board, they make you redo it, of course. And I called them and I said, you couldn't have possibly come up with a new exam. Did you just type the questions from the other guys, And they said, yeah,
You're so.
you stole the test, But essentially, how sad that we've had to go through 90% of the opioid and other epidemics. It's not just opioids
Mhm.
epidemic. It's basically the ignore your brain and mental health epidemic. We shouldn't even call it the opioid epidemic. Um,
Right.
the attorney general, I work for them doing reviews, and he asked me once, he said, "Hey, what about the benzo epidemic, like Xanax?" And I'm like, this is
Mhm.
all in the same, we're already in the Xanax like we're just calling it the opioid. But
Food
most
is an
people,
addiction.
food,
Food.
absolutely,
Yeah.
Food.
Yeah.
They're
Yeah.
basically,
all
it's an epidemic of ignoring
mhm.
our mental health is really what it is.
Coffee.
Yeah, right,
Yeah.
Coffee.
right.
Yeah. And I
Any
think that's.
substance, right?
I'm sorry. Go ahead.
Any substance that you're using for the wrong purpose that gives you health consequences, that impacts your social life, your personal life, and that you can't get away from, and you're using it as that kind of a coping skill, that's an addiction.
That's addiction.
Yeah.
That's
Absolutely.
Yeah.
simple,
And you mentioned like epidemics, and one thing I know, I've been on your website where one thing that you exclusively advertise is you don't just write pills, right? You get with the patient, you talk with them, you find out about them
Yeah,
specifically and individualized.
right.
And that's a very hot button topic right now, right? Because you speak of epidemics and it is just so out of control. And the drug industry so eager to sell pills like candy for anything, doesn't matter what it is.
Horrible.
Can that ever be curbed or lessened, or has
Yeah,
it became way so corrupted that
it
it's so
will,
difficult?
but only if we can teach. And this is one of the reasons I love teaching med students and residents. You got to teach these folks from the ground up. The older docs, they're just too far down the rabbit hole. The
Mm,
newer ones, yeah, they're excited about this stuff. I've got med students I teach, and when we look at the treatment look at anything. Again, I always say treating mental health and addiction is no different than any other part of your body. Look at
mm,
every aspect of the recipe. What I do is no different than what a chef does or a dentist. We all have our 30 or 50 or 100 tools, and you better use them in the right order and the right ratios at the right time, or your product is not going to turn out. And if I tell people, look, one of the tools for addiction in psychiatry is medications, and there's 10 different kinds of medications and 10 different subcategories of those. But then there's also non-medication treatments, therapy, cognitive therapy, EMDR therapy, acupuncture, meditation, getting proper sleep, diet, exercise builds up your own endorphins. Like there's a lot of those components, and people say, well, which ingredient is more important? Is it oregano? Is it salt? Is it chicken stock? Is it
Mhm.
adding heat to the pot? How about the pot itself? Is that an important part? They're all differently important. You can't afford to screw any of
Yeah.
them up. If you mess one of them
Right.
up, the whole recipe might have been perfect. It's like one thing.
Mm-hmm.
And the whole thing looks, and that's why I get a lot of patients who are like, well, I've tried this med, it doesn't work. I've tried that treatment, doesn't work. I've done therapy, never works, you know? Like, well, you
Because
probably
you didn't put
done it,
effort.
right? You've probably
Yeah.
done it the way I cook, which is not good, you know?
Mhm.
I cook
Mhm.
and it doesn't turn into anything. I ask my friend who's a chef, and he comes in, he cooks with the same spices, and weirdly enough, it turns out just fine. And I say, I
Well,
don't believe in the spices. And he says, it's not, the oregano was never the problem. You're the problem. You don't know how, you're a bad chef. You don't know how to cook, you know? Like,
well, we could no more walk in your office and treat someone with,
Yeah.
gout
Yeah.
than,
It would
then,
be like
you know.
if I read a medical manual and said, "Oh, I can
Yeah,
cure
I'm a
patients
doctor.
just like you do because I read the manual," but no, of course not. Yeah.
there's
I
more
think
to
I
it.
am.
There's
I
more
think I am.
to it.
I'm that
Yeah.
mom doctor that every
Right?
kid comes to because they like cut themselves or,
Absolutely.
falling on the things. So, yeah.
But the
yeah.
recipe is so critical. And people
Mhm.
come to me and they're missing one component. And I say, what a bummer, because everything else looked fine, but you're missing this. You're not getting proper sleep. You're not doing any exercise. You don't have a
Sleep.
serotonin
Sleep,
medication.
people.
Sleep is
Sleep.
critical. Sleep is critical. And not with Ambien, not with drugs,
No.
organic.
You have
Yeah.
to learn meditation. You have to learn how to
Meditation, right?
put yourself
Doing
to
it.
sleep.
And why is it that every profession gets to use the proper tools? You, Neil, you've probably got 20 tools right now. You've got cameras, microphones, editing equipment, all sorts of stuff that you're using for your work. But they come to me and they're like, Doc, I don't want to do more than one medication. Like, I just want to do one treatment, That's really bizarre. Like, you don't go to a dentist and say, I just want you to use 2 tools, but no more, please. I'm just
You can't,
all
yeah.
the tools. I say,
Yeah.
use all the tools you want because I don't want to hurt and I want you to get the job done properly. You choose what tools you want to use,
Mhm.
They don't all have to be sharp, okay? But
Not a lot of sharp tools in that shed.
right? Right? And if we do mental health the way we do plumbing, which is,
Exactly.
I have a wrench and I use it for everything, that's not going to end well. The plumber's going to look at me and say, what did you do here? Well, I just used one wrench to hammer nails. And no, you don't do that. Use the right tool. If you don't have the right tool, refer to somebody who does have the right tools,
Yeah, a specialist.
It's so amazingly no different than anyone else's work. And yet they look at me like I'm from Mars when I say, well, we're going to treat your addiction and your psychiatric problem the same way a dentist does, or an engineer does, or, a videographer does. Like, I got my tools, they got their tools. Let's talk about what tools make sense, which tools make sense to both of us. And then let's go through this pathway logically together. And there's different directions to take it. I don't care which direction we start with, but it's got to be a cooperative work. It's not, here's your pills, go away.
Exactly. Well, when 2 of my children started middle school, I put them in therapy because I knew it was going to be tough for them.
Right.
Best thing I ever did.
It's the best thing.
Best thing I ever did.
When we say, why don't we have, if we focused therapy, if we took, and what if we hired 2 million psychologists to exclusively work in every middle school student is assigned to a real psychologist.
Bingo.
And you did that for 4 years. Like, if we invested the money in that, how much money could we shave off the back end by not getting them addicted to weed and heroin and everything else, Right?
Now that is my next question about medical marijuana. And, my daughter went through cancer and it helped her with her nausea and sore mouth and stuff like that. I mean, what are your feelings on these pot stores on the corner versus
the same as every
liquor store?
else. It's the why, not the what.
Okay, perfect.
So if I have heroin addicts that come to me and they say to me, do me a favor, tell these kids that weed really is a gateway drug, or it can be a gateway drug. It's not for everybody, but it really can be. I'll say,
well, the THC is so powerful now.
Right. but it's the why, not the what. So when people come to me and say, you know what, I have a problem, we're using THC for nausea, we're using it for, and if I can get people on THC, some oils, and help reduce their narcotic load, that's a good trade-off, you know? That's
okay.
That's a real purpose, okay? If we can help their neuropathy pain, there's a lot of good studies out there that are looking at where can we use it, where is it helpful? Because there's a difference. If somebody says, hey, you know, I want to have a beer just watching a football game or a glass of wine with friends, you know, and I'm not driving and I'm of age and yada, yada. I say, okay, that's fine. Okay, stick within the rules. Don't kill your liver, you know, never more than 7 a week, you know, stick to the rules. But if somebody comes in and says, hey, I want to have a glass of wine because my life sucks, my marriage sucks, my boss is a jerk, that's a big fat no-no. That's like not even a sip of beer for that one, because that's self-medication. That's for the wrong purpose. You should be doing therapy and other stuff for that, you know? So, you know, the problem is that the majority of people doing marijuana, they want it for the numbing effect. They want it for the numbing effect so they don't have to feel their problems. And that's what a lot of the middle schoolers will tell me. Well, it just calms me down. It treats my problems. And it solves no, it doesn't solve your problem. And that's a vastly different thing than when people are using it for true medical purposes, like nausea, like appetite, for folks that have chemo or whatever, you know, like that's or for pain management when we need to, when they have chronic pain. You don't use insulin unless you've done dietary therapy or unless you've done pill medications, unless you've done weight loss, then you do insulin. Yes, we do cannabinoids at times, but first you got to make
sure. What's a cannabinoid?
Oh, the CBDs. The CBD.
Oh,
right.
Okay. Oh, okay.
So there's CBDs and THC in there, right?
What is the difference?
CBD.
I don't do that.
CBD,
I don't do pot.
Right? CBD is the tool that is the most helpful for most of the medical conditions. The chronic pain management, the neuropathy that we use it for. But it's not, the THC is the more is the part that causes the more psychedelic component, the numbing out, the kind of buzz, you know? So if you look at most of the products, there's CBD, the oils, the gummies, the this, the that, the topical creams for pain management, you know? The THC for the most part, and that's what a lot of kids want, because they just want to numb out to their problems. And numbing out to the problem is not the same as dealing with your problem. And I have so many kids that tell me, well, I still do, you know, a little bit of weed. And I'll ask them, what does it do for you? And they're like, well, it just kind of helps relax me, makes me not worry about stuff anymore. Well, okay, I get it. That's legit. But is that really the same as processing a problem? If I spray paint over my rust spot, it looks a lot nicer.
But it's still a rust spot.
Is that really really the way to do it?
Right.
If you really want to do it, you got to roll up your sleeves, sandpaper, 3 layers of primer. It's a lot more work. Now, you know,
you got to work on that brain. You got to work on that brain.
We want to treat always, and this is what I always say, always want to treat the underlying problem, not just the symptom. The symptom is of anxiety. Okay, we can slam down the anxiety with some THC, with some alcohol, with some whatever, you know, Oreo cookies. But is that really what you're looking for? Or should we try to address the relationship problems that you're having with friends or family, or like, how do we deal with that? Because guess what? When that spray paint falls off the rusty car, the rust is still going to be there, and probably it's going to have grown. So you might want to address the underlying problem. You know, do I care if a 40-year-old person wants to sit in his basement, smoke a joint, and feel stoned like he's a teenager? No, I don't really care, you know. But again, why are we doing stuff? I care the same about somebody drinking alcohol. Yeah, to enjoy it here and there, good, fine. To deal with your boss, no go.
No.
Not happening.
No.
Not a good choice, because that means you're not addressing the underlying problem, which is the relationship with your spouse or your boss. You know, always treat the problem, right? And in our society, we're into instant gratification. That's why people come in. Oh, give me a pill just to solve what I'm feeling. You know, where's more cough medicine? Well, how about treating the pneumonia? You know, that might be better.
I know.
Right. Yeah.
So we lose that because we are a society of instant gratification. And I think Part of that is we enable that. That's what we're looking for. That's what social
when
media
we put the
tells us.
pot stores on the corner and the liquor
Right.
stores and
Right. We're saying that's our priority. That's what we focus. We want to focus on not feeling stuff. It doesn't mean there's not legitimate people going and buying a bottle of wine for their party. That's nothing wrong with that, right? But
just don't drive.
Right? Predominantly, I worry about us using everything under the sun to not deal with the problem. And again, how much could we save if we just mandated, we don't like that word in this country, if we encouraged every middle schooler to have proper therapy and help them navigate some of these hard times, where you have two options as a parent. Either you help your child navigate those difficulties, or they're going to do it on their own. But one of those two is going to happen. And they'll be my patient if you don't do it, which stinks. I'd rather you do it, And
well, what about in this time right now of COVID? Are you seeing a lot more?
It's off the rails.
Where people are, kids, home and they're just...
These teenagers, it's off the rails. These kids don't have their outlet. They don't have their friends to corroborate with, because they blow off steam just talking with their friends and just kind of existing. And they have to go home to their annoying parents eventually, but at least they get a couple hours a day of feeling like, hey, the world is ours, Now they're at home with their parents 24/7 being annoyed. They have one outlet, and that's their cell phone. And where do they go with their cell phone? Instagram, Facebook, Snapchat, TikTok. And there's a lot of diseases that are now surfacing because of the influences of that social media, which tells our kids, you need to be skinny and pretty. You need to be this. You need to be that, I have teenagers coming in all earnesty, handing me a list of the 6 first most important plastic surgery procedures that she needs when she turns 18. And she's got them arranged, but she arranges them differently depending on the day. But she wanted my opinion as to what I thought might be more important than another thing, so she could really make sure that she gets her order right when she turns 18. And my jaw hit the ground, and I looked at the mom. The mom was clueless. And I said, well, I wonder where the problem is. Who's the patient, really? Does the problem does it really start with the kid, or is it start that, with parenting, or is it start that we have basically handed over parenting to TikTok? Because you don't let your kid, if you give your kid a car key, you're going to say, where are you going? I need to know where you're driving, what part of town you hanging out, who are you with, If we just gave our kids car keys and said, well, whatever, just go drive wherever you want, how would that be good parenting? And if you're driving your brain into uncharted territories, no, I'm not. They're not uncharted. They're very well documented waters, dangerous waters. Would you really let your kid just take your boat out into, crocodile infested waters, with no oversight? I mean, you wouldn't do that.
Can I ask which kid? No. I'm kidding.
Right?
No, I'm kidding.
We have more work to do. Nowadays we have a lot more work. It used to be that you could snoop around your kid's room and you could find stuff, but now there is, if you find a stash of weed in your kid's room, that's one thing. But what about all the hundreds of hours of damaging social media that's hitting your brain's cerebellum and changing their feelings about themselves at a time when they are the most impressionable in the teen years. That's
get them into therapy.
Get them into therapy. Yeah. But that takes a lot of work, and it's annoying. And then as a parent, you have to kind of understand that your kid might have a mental health problem, and we'd like to just ignore that and see if it'll just go away.
No.
Right?
It doesn't.
And that is why my business is basically never ending, because we refuse to do that.
I want to come out there and help and work with you.
Right? I always get kids after the fact.
Work with kids. Work with the kids.
Kids after the fact. We did a meeting at a local high school across the street from one of the clinics we started. It was a methadone clinic. I run a bunch of clinics, but my own regular practice is regular addiction and psychiatry, but these are methadone clinics, and it just happened to be across the street from a high school.
Great place.
Well, yeah, good place, but they were angry. The principal was beyond furious. And it's in a downtown area. I'm like, well, it's okay. I mean, we're right next to like 5 weed shops and 8 liquor stores, you know what I mean? Like on the strip, you know, like that's where the high school is. And the principal got irate, and she looked at me. She said, Dr. Edrich, what are you going to do to prepare my kids for addiction? And I said, I'll be happy to come over, have roundtable discussions. They can come over to the clinic. We can teach them. Patients can help them understand what happened to them and help them learn. I mean, I thought it was already your job to teach kids about drugs and alcohol. But if you'd like me to come in and do it for you, I'll be happy to. Because if somebody doesn't, I'll be taking care of them after the fact. So either you do it now, and if you don't already know how to do it, I'll be happy to hold your hand and spoon feed you. But really, that ought to be your job already. But let me know if you'd like me to come over, and I'll be happy to teach those kids. In fact, they probably already know 10 times more than you do anyway. So you better brush up, because they're already way more in the know than you are. These are high schoolers. They've already been through the middle school years. They've probably already tried. This is downtown. They've already been down the weed and the cocaine around. Like,
just scary.
Right?
Just
I would
scary.
strongly suggest you get going on your task, you know. And she didn't like that answer at all. Imagine. But that's the reality of it, is if we don't help our children navigate those waters, and those waters are in the middle school years. Most parents are still kind of in denial. Kids are cute and sweet and doing what you want them to do. But how many parents come into the room and they'll say, man, I wish I would have known my kid was already doing this drug. But in private, the kid's like, my parents don't know. I've already been doing this for 8 years. They think I just started last year, you know. They've missed the boat. They've missed the boat.
Yeah, definitely.
Why are we so afraid to ask our kid? Why are we so afraid to drug test our kids? I drug test my kids. Hey, drive the car, drop a urine test.
In high school, I did,
Yeah, we can all drop urine tests. We'll be non-judgmental. But you're not driving a 5,000-pound steel vehicle around town with any substance on board. That's not happening, you know.
I had my kids. They had a picture of a drug test on their phone, and if someone said, "Here, do this," go, I get this when I get home.
Right. Most of my addiction patients, they're the most thankful people in the world. When you help them get free from those chains, from those bonds, the words they utter are so profound. Is saying, hey, I've got my life back. We had a patient today who told my nursing staff, and the nursing staff was like, man, I'm sorry you have to trudge in here every single day. And the patient was like, you know what? Thank you for saving my life every day. Like, this is this is worth it. This is my daily life-saving thing. I need to do this, you know? But if I asked them, had you wished somebody would have intervened in your life when you were 13 and this all started? Their jaw would have, like, in a heartbeat. Like, if I could have avoided all of this between 13 and 30, oh my gosh, like, how different would my life be?
Exactly.
You're not doing our jobs.
And you talked about, like, different people needing different approaches, all individualized, right? And another thing you pointed out was how versus why, right? And I always wondered, is that a major factor of why some people in their, say, college years, right, drink like crazy, do drugs or smoke weed or whatever, but still don't get addicted, right? Once they're in their late 20s or early 30s and move on to the real world, it's like, oh, that's over. So is that the difference of why some people can do all that even in access and still not get addicted?
Right.
Genetics, right?
Genetics, exactly. Genetics.
Yeah.
Why is it that one person with the alcohol gene, they have 1 or 2 drinks and all of a sudden it turns into 30 drinks? But I can have alcohol, I don't really like the taste of it, and I have 2 and I'm like, ugh, I'm done, you know? And predisposition to any disease, and again, this is why it's so mind-boggling that the world has not recognized addiction medicine until now, because it's identical to every other.
People had to die.
Right.
People had to die.
Why can some people eat all the carbs and sugar in the world and they don't gain weight and they never get diabetes? And other people, diabetes runs in their family and they look at a carb and they get diabetes. Why is that? Because the genetic predisposition mixed with the time in their life, their age, male gender sometimes, impulsivity, immaturity.
Oh, okay.
Now, if you match immaturity, age, impulsivity with a predilection to an abuse, to substance abuse, like a family genetic, that's a really bad combo. Now, if you have a kid in middle school who only has one of those items, maybe some impulsivity, but not so much immaturity. Well, they're all immature in middle school, but you know what I mean? Like if only one of those things is off the rail, they're a little bit at risk. If more are off the rail, they're even more at risk. Why do kids with attention deficit, ADHD, why do those kids have a higher risk of addiction if they're untreated? Because ADHD makes these kids feel bad about themselves. Their self-esteem goes down. They recognize they can't keep on top of stuff. They're kind of being looked at or chastised by the teachers or their parents, and they feel bad. And what do? They look for something to help them not feel bad. Now, why do you think kids with ADHD who are treated have normal addiction risks, right? Because they treated the underlying problem. So it's a combination of things. And the more of these factors you have, the more likely that fire is going to flare up. Immaturity, impulsivity, sometimes boys more than girls, but it goes both ways. And then genetic predisposition. And which one of those is the most important? Hard to know. We don't know how to grade that.
Yeah. Well, getting to genetics. Okay. So, I had to have a aneurysm fixed on my heart because my mother had it, her mother had it, my sister had it. My mother actually died of it. They didn't know it. So I'm having my kids watched for it, right?
Right.
And then you throw in the factor I'm Irish, and that is like what people say, is like, So do you think we will ever get to the day where we can manipulate genetics to stop these what do you call it, desires, wants, addictions?
So
do you think we can mess with that one day?
So you're talking about CRISPR. So you're talking about using genetic manipulation to go in, change DNA, and reintroduce it into the body and have permanent changes. So I know China's trying some of that. But
I read that too.
Right?
That's what made me ask the question.
That's a whole bag of worms, especially in a child. Do you go in and intervene in a child's DNA?
I wouldn't want that.
Right. It's that's in its infancy. I mean, I can see it going down that road, and I can see people experiment, and I can see a very long road before something like that gets accepted. It's hard enough for people to accept mRNA COVID vaccines, for God's sake.
Oh my gosh.
And that's I wouldn't worry about genetic manipulation. Can you imagine CRISPR on your kid to prevent alcoholism? Like, that's just a nightmare. Like the whole idea that what if we can produce something in the body that fights the addiction, kind of like an immunization? So they've actually come out. I know people don't
I love that.
COVID, but what about a vaccine against cocaine?
I love that.
They came up with that. They actually came up with vaccine. So you take cocaine.
Let me guess.
Right?
Let me guess. Pharmaceutical companies stopped it in its tracks.
Well, they didn't like it so much, but you could make a lot of money off of it, technically, and it's kind of a niche. However, the technology, and it's getting better and better over the years, but the problem was the vaccine would latch onto cocaine and prevent it from going to the brain, so they wouldn't feel the high. But the antibody wasn't strong enough to prevent it from going to the heart. And so these people would just get more and more cocaine. It would go to the heart. The heart would have a heart attack, and so they could get high off of it, but it would still cause huge heart problems. But it's the idea. The idea about that kind of stuff, like how do we? But again, we're always talking about after the fact, aren't we? How about before the fact? We use a lot of, it's all about preventive medicine is what we want to do. How do we prevent breast cancer? Well, how about don't smoke? How about don't eat all this crap? How about don't this, don't do that? Skin cancer, let's not do so much sun exposure. Prevent it. But where's the prevention for mental health that leads to addiction? Where's that? Why have we blown it off? Why don't all parents like you take their kids to therapists preventively in middle school? Like we all know it's going to be horrible. You may as well just take your kid now instead of denial and then take them when they're 30. Like, why don't we do it now? Spend a little extra money to invest in our kids' future, and honor the fact that, if we can prevent these things, because those kids who have had mental health issues prevented or addressed immediately, they don't become my patients,
Exactly.
They were a therapist. Or maybe they need mild medication, simple, easy stuff that's like, but once they navigate those years, they don't become my patients down the road. That's the better, I don't need the extra. There's way too much.
No, exactly. Right. Yeah.
Not a lack of business.
Isn't that though fascinating that even we're in the 21st century, right? And we clearly know far more than we did, say, 17th century, 18th century about mental health. And yet there's still a stigma against any kind of medication for the brain, therapy. Oh, I'm not crazy. Why should I?
It's not about being crazy.
Exactly, right?
Not about being crazy.
It's, crazy are like
being
in-laws.
Stressed out.
Right? Crazy are like in-laws. That's where crazy belongs. When it comes to mental health, you're absolutely right, because we don't honor the brain as an important organ. And once we do, then our eyes open like, wow, I guess the brain is kind of important, I've got big cowboys that come in with their arms crossed, like, I'm not dealing with all this crap, And sure enough, after a couple of sessions, they start lowering their guard. They start talking about the stuff that bugs them and how it's kind of a bummer that it bugs them and how it does impact their lives. And I get the strongest cowboys under control, but as a society, we have to let our opinion be known that we're stronger than you are, because I don't limp, I don't have a brain limp. You might have a brain limp, but that's just because you're weak, And that festering opinion, that's getting better over the years, and patients are coming in quicker and quicker. A lot of my patients are referred by other patients,
That's the best kind of medicine.
Right. I have
when they refer.
I have a ton of kids whose parents are like, well, I heard you're helping my friends' other kids in the same school, and like they're dealing with the same stuff, or in addiction, the addicts refer each other. They're like, well, you helped my buddy get off of heroin. I was just really afraid to come in. One guy pulled out my business card. It was all like ratty, gone through the wash 3 times. I'm like, how long have you had this for? And he was like, probably about a year. I was just too afraid because I was worried about you judging me or chastising me. And I was just kind of afraid of it, because they've already been chased out of 50 other doctors' offices because our own medical system still chastises people. How sad is that? Like,
it's horribly sad.
I have to call doctors and say, listen, I want to have a friendly chat with you, but this patient won't see you anymore because you judged him for what he was doing. And he disappeared for 6 months. He finally shows up in my office. You're still giving him oxycodone because nobody bothered to ask him if he has an addiction, by the way. And I'm glad he's not dead yet, but I just wanted to help you figure out some ways to kind of deal with this person, because it has to be done. I have addicts referring addicts. I actually had one kid come in on heroin addiction. I said, how'd you find me? And he's like, oh, my dealer gave me your number, Okay. So it's on the underground. Cool. If you want heroin, I got that. If you need a guy to help you get off that stuff, I'll give you that too, whatever you need.
Oh my God, that is the funniest thing I've ever heard.
Yeah.
Oh,
it's on
Doc,
the
I'm telling
These
you.
guys are like, oh yeah, your name's all over the underground. They all know you. You're the guy that helps people get off the stuff,
We need a lot more doctors like you.
We certainly do.
Whenever you're ready. It's
your heart, your kindness, you can tell that you have that compassion, that you're not judging people.
No,
you know.
None of us want to be judged, and we all
Yeah.
know that.
No.
And yet,
Mhm.
we're so quick to judge others. Look at social media;
Mhm.
it's all about judging, right? I mean,
Mhm.
first thing that pops
Yeah.
up is judge you about this, judge you about this, your size, your
Yeah.
weight, your clothes, your how you should walk, how
Hmm.
you should behave, how you like. Oh my gosh,
Yeah.
it's,
Yeah.
it's
Well, my
everybody
therapist told
else,
me 50% of the people on the planet are going to like you, and 50% aren't. So stay
right?
the ones away from the
Right?
ones that
Yeah.
aren't. Just
But it's hard for a
Exactly.
middle
hard.
school. It's hard for
Yeah.
middle school to understand. You know what? The half of the people that don't like you, they don't matter. It's hard to tell them that because they don't.
Yeah.
Their maturity level,
They're the ones that.
get it,
Yeah.
right? For
Mhm.
Yeah.
us, we're like, you don't like me,
Exactly.
fine, go away. See somebody
Mhm.
else. No,
Mhm.
Yeah.
find
But
somebody else.
see, even at my age, at 75, no, I am seeing a therapist that is saying, half the people are going to like you, half you are not. You
Right?
know what? I don't care anymore. I'm like, I don't
Yeah.
care anymore. I don't
No, and
care.
that's wonderful. And even patients, I had one lady come in, she's like, she was older and she's like, I don't know, you don't even look like a doctor. You don't wear a white coat, you're kind of too friendly. I was like, that's cool. Then, there's a dude upstairs. He wears a white coat and a tight tie, and that's
Button
what he looks
down.
like. And maybe you'll click better with him. That's awesome. Go find
No.
somebody that you work with. I
Yeah.
love it. There's nothing wrong with that.
Mhm.
Um,
Right.
I'm just
Well,
about
I think anybody that walks in your office is going to be
Yeah.
a lucky person.
What's funny
Yeah.
is when I transitioned into addiction medicine, some of my other doctors, they're judgy and they're like, "Oh, why? So you're just going to work with junkies?" And I said, first of all, they're not junkies. They're your
Not
neighbors, they're your
junkies.
relatives,
Yeah.
they're your children, and your
Yeah.
nieces and nephews that are coming in. And number two,
Mhm.
Right.
you'll never be able to recognize if you walk into my waiting room. You'll never know if the three-piece suit dude is there for heroin or a hangnail, and the guy that looks like a bum might just be there for cholesterol meds and nothing else. You'll have no
Mhm.
idea
Right.
because you're walking right past them and you never bother to ask.
Don't judge that
And
book.
my door still says family medicine on it, and a lot of people like that because they're like, well, people don't know why I'm here. And like, yeah, it's none of their business. You're here because you're a
Right.
human and you fell on your face and you want help getting up and moving on with your life. That's why you're here. Like nothing else
Right.
matters. Nothing else matters.
Doc,
Confidentiality,
would
right?
you
We gotta
promise
have
to
you.
do a part 2 with us? Because we could
Because
talk all
we could
day.
talk, and there were
You
so many
are.
questions. We had
I
another
know we didn't get
couple other
we didn't get through
subjects
half our. Yeah, we didn't get through half our
dissociative, but
questions.
Sorry.
because your answers were so perfect and articulate, they were
Perfect.
so fascinating that I
You are
didn't have the heart to
amazing.
say, okay, let's switch subject. I couldn't do that.
No.
No, this was
No.
too good. This was
Because
way
we
too
could
good.
go here, we could go here, we could go.
Yeah,
I
yeah.
have
But
so many questions about
Love
this.
it. Love it.
yeah,
More than happy to do
so
that. More than happy to do it.
Thank you.
yeah,
Absolutely.
please come back for a part 2 at
Yeah.
some point. Yeah.
Please. We're gonna book them after the
We
show.
have
I don't
other
care.
subjects that you specialize in, and so many other things to ask you.
Yeah.
So
Yeah.
So I have a hangnail right here. I am.
Well, it's interesting because a lot of patients, and I tell like my practice is still family medicine and addiction and psych. Most of my referrals are patients with addiction and psych because naturally that's what happens. They just show up. But I tell these people, look, if you have a family doc, great, they'll take care of your client. If you don't have anybody, a lot of these people's regular medical problems get dropped by the wayside. And while we're talking about heroin, hey, let's check your blood pressure. Let's get your flu shot. Let's do all this other stuff. Real quick. Why not? Let's take all this other stuff under control that you've kind of blown off. The only thing I don't do is dentistry, right?
Yeah. Well, you're a full circle. You're not like, let's just do half of it and then blow off the other half. You got to do the whole circle from here to that hangnail in your toe.
Right. And people ask me, oh, why do you do addiction medicine? And I ask my friends, like, why don't you? They're in front of your face too.
Compassionate. Because you're compassionate.
You're just not asking them what's going on in their lives. They're not opening up to you. They're walking right in front of you and you're not seeing it.
You'd be surprised.
If I see a pregnant lady, I'm going to say, oh, you're pregnant. I don't do pregnancy. Here's an OB for you. And I refer you out. But just because you can't see addiction and mental health, you're just not even bothering to ask. Or they don't have a sense that you're non-judgy, and they don't feel like it's a safe zone for them to open up.
Yeah.
And if you don't provide that safe zone, even if you want to refer it out, you'll never discover it, and it'll just walk right past you and overdose the next week, Yeah.
Well, my daughter wants to be a therapist because I put her in therapy. She wants to help children that have anxiety and depression before they get to the point of no return.
That's what we need. A thousand million of those people. That's what we need. Yeah.
Let's pay our scientists.
Yeah.
Let's pay our scientists what we're paying athletes, and the world changes like that.
There we go.
That.
And if you're a parent, and if I said to you, hey, your kid now has addiction, they're 20 years old. If I said, if I could dial the clock back and said, if we can get your kid therapy starting at age 10 until the age now, and it would cost you $100 a month, would you do it? And I'm like, oh, absolutely. I would totally do it,
Of course.
Everything looks rosy.
No one wants their children to be that,
Right?
Nobody
but until then,
does.
we would rather just plug our ears and be in denial.
Which is not a river in we're denial, guys.
Right. But yeah, let me know. We can bounce back and forth and find more time to talk. Absolutely.
Oh, I'd love it. Right, Neil? We'd love it. We just love it. Love it. You have been this is honestly one of my favorite conversations we've had on this podcast.
Let me know where you guys publish it, because I'd love to link it to my own.
Oh, we're going to send it to you. Absolutely.
Yeah. I do it
will be on YouTube Saturday morning. So we will make sure that you get a couple of weeks.
Video
we
blogs.
We will directly email you the link. So you'll have it. Yeah.
That's awesome.
And people, if you're in the Denver area and you have, issues, go see this lovely gentleman. Amazing doctor.
Very good segue to tell. Can you tell people where they can find you online and your practices and all that?
Absolutely. Heritage Hills Family Medicine, Addiction Medicine, and Mental Health. It's a long word, but just Heritage Hills should usually, or my last name Edrich will pop it up. You can just Google my name, Andreas Edrich.
Well, Neil and I really want to concentrate on mental health, and so I think that you are such a good
specialize in.
Such a good person to have, and
we can
in our back pocket
and talk about different mental health issues all in of their own right,
There's not just one. It's not just in a box.
There's
many.
We had like questions on this and that, and
I know we
So
did.
fascinating that we just had to hear you out.
These are all my questions. But you know what? You are great. So
this has been
that's awesome.
You are a great guest. We really appreciate it, Doc.
Thank you guys for doing this work for sure.
Hopefully
it'll hit the right ears,
Well,
yeah.
Sam has a lot to do with it, so.
That's
anyway,
awesome.
Okay, you have a good day, and we will send it to you, and we will be in contact with you. And thank you from the bottom of our hearts.
Have a good week, okay?
Thanks.
See ya. Bye.
Bye. Have a good day.
Bye. Thank you, everyone, for listening today, and thank you to Dr. Edrich for joining us. Want an exclusive sneak peek at our future guests? Go to our website, dailywisdomwords.com, where you'll have full access to our podcast page, which is updated every Wednesday morning at 9 a.m. Pacific Standard Time. On that page, not only will you be able to see who the upcoming guest is, but also ask a question for that guest. You'll also be able to submit any feedback or suggestions you have for us in our podcast. We want to hear from you.
And we want to thank everyone for joining us today. If you are a writer and not a member of Daily Wisdom Words, sign up. It's just $10 for a lifetime membership. No dues. Take part in our active writing prompt, groove to a little music, build your own social media profile, meet and interact with other writers just like you.
Once again, that's dailywisdomwords.com. Make sure to follow us on Twitter, Instagram, and Facebook at all the links listed in the description. And don't forget to hit like on this video and subscribe to this channel so you never miss an episode. And if you want to show us a little extra love, We also have a link for donations in the description. Thank you, everyone, once again, and we will see you next week.
Thank you. Bye.